Being overweight and obese increases the risk of complications and hospitalizations from COVID-19. As your BMI increases, your risk increases. A higher BMI can impact the immune system, which can make a person more vulnerable to complications. People with obesity are also more likely to have conditions like heart disease and type 2 diabetes, which are also risk factors for COVID-19 complications. If you're overweight or obese, how does that affect your COVID-19 risk?
Having overweight or obesity actually increases the risk of complications from COVID-19, not of contracting COVID-19. There are several different parts to this. First, mechanically, having abdominal obesity can actually press on the diaphragm. If the lungs are compressed, they can't fill with air fully, which is not advantageous when someone has COVID-19. Secondly, obesity usually occurs with other metabolic problems like high blood pressure, high cholesterol, heart disease, diabetes, or insulin resistance, and all of those combined, or even a combination of those independent factors, can increase the risk of complications from COVID. Thirdly, there is immune dysfunction. We generally recognize that people with obesity have higher levels of immune chemicals called cytokines, and part of the complications from COVID-19 can occur when there is a cytokine surge or storm or an overwhelming level of these chemicals. Lastly, people with obesity tend to have more easily clotted blood. We're finding that people with COVID-19 more easily clot their blood as well, and so having obesity compounds that risk.
For those people who are overweight or obese, what do you recommend to manage their risk of getting COVID-19?
People with overweight and obesity should manage their COVID-19 risk by performing the following things. Frequent hand washing is of paramount importance. Mask wearing on a consistent basis and avoiding large gatherings is also key. If they are diagnosed with COVID-19, it's very important to stay well hydrated, to quarantine, to take all prescribed medications per their doctor's directions, and to have an action plan should their symptoms get precipitously worse. I would advise my patients with overweight and obesity to take this time to take stock of their lifestyle. Perhaps there are small changes in diet and exercise that can lead to even incremental loss in body weight, which can improve the risk of developing complications from COVID-19.
If you're concerned about your risk of COVID-19 complications, talk to your doctor. They may help you make a plan to avoid getting sick and how to manage if you do get sick.